Hi, this is Victoria with Holistic Recovery Services. I am coming to you today to talk about some training and do some education and to learn about harm reduction. Last week, I did some education and presented on nutrition for mental wellness. And so every week I would like to do a different topic and to educate folks that are struggling with substance use, as well as family members and general public. My goal is really to change and shift how the world views addiction and how treatment programs are offering services and bringing holistic healing into addiction. And part of that mission and part of that overall goal is to also educate the folks that are receiving the treatment and helping family members understand the options and the different ways that somebody with addiction or with substance use can get help, and how that help can be different, and maybe the pros and cons of the different perspectives and different treatment options out there. So today, I want to talk about harm reduction. Harm reduction is something really special to my heart, simply because it's the way of treatment and viewing addiction that has less shame to it. There's more support, positive view of folks with addictions or with substance use. And so, the harm reduction model, it's the new model. It's the new understanding of addiction that breaks away from the old models that cause shame, that elicit shame, that are based on a moral understanding or moral belief about someone with substance use. And harm reduction is where progress is. Harm reduction is where the future of addiction treatment really is. And programs that use harm reduction as their perspective and using harm reduction strategies, they're just more effective. And they're, harm reduction may not be for every single person ever. Harm reduction, similar to abstinence only, abstinence only programs are not for everyone. And so harm reduction is just on the continuum. It doesn't replace abstinence only. It is just part of a bigger continuum where abstinence is on one end and full chaotic substance use is on the other. And harm reduction is in this middle place of, well, let's reduce harm. Even if somebody doesn't want to quit using completely and they want to continue to use, let's at least find ways to reduce harm. An example would be drinking and driving. If someone has had a couple DUIs and they want to continue drinking, it's not in their interest to quit drinking completely, then harm reduction strategies and harm reduction therapy would help someone come up with strategies on how to reduce the risk of driving drunk. If you're going to keep drinking, perfect, fine, do it without driving, right? And so harm reduction therapy simply is this place of, if you choose to continue using, then here are some ways, here's some suggestions. What are some suggestions? Also going back to, what ideas do you have about how you can reduce harm from your own substance use? So I wanted to talk a little bit about the differences, kind of the background of harm reduction and abstinence only, and talk about some pros and cons of both, as well as why harm reduction is a very beneficial strategy and perspective for a lot of folks, and how we can also incorporate that into family education. Family members that are watching their loved ones struggle with substance use or alcohol use they're concerned, they're worried, they've seen a lot of problems from it, and their expectations is quit using, period. And it's like there's no in between of, in order to meet a goal, in order to change a behavior, in order to change a habit, there's steps. Almost no one can change a habit overnight and just boom, done. And yet we think that people can do that with addictions, and that people can just stop using substances overnight and boom, it's done. Some people can, some people have done it that way, and that's perfectly okay. There's a lot of people that do it without treatment. They never get treatment, but yet they find their recovery. That's perfectly okay. There are people that, but that's not for everyone, right? Not everyone will be able to quit overnight. And it doesn't mean that there's anything wrong with the person that cannot quit overnight, because it's human nature. It is human design that when we have habits, that it takes time to change those habits. It takes small steps. We often talk about making change means that we're making small steps towards a big change. So if changing substance use means that it's no longer a problem, or we no longer use at all, there are small steps to take. Small steps are harm reduction. Small steps means that we are making changes in certain ways, in certain places, to reduce harm until we get to a place where it doesn't have any harm, right? And so, yeah, I just want to talk about a little bit about harm reduction, and kind of the beliefs behind abstinence only and harm reduction that kind of help understand where they come from. So abstinence only comes from both the moral model and the disease model of addiction, and understanding addiction and the cause of addiction. So the moral model says you are a sinner and you use because you're a sinner. So the moral model puts the reason someone has addiction completely on them as a bad person, right? You are immoral, you are a bad person, you need exorcism, or you need a spiritual intervention to make you no longer a sinner in that way, and for you to be in recovery. Okay, so there's that, which has a whole bunch of shame. It has no basis of truth. It has no value of any alternatives, right? And I mean alternatives as in alternative ways to recovery, right? It's one way of recovery. It's one cause, one solution, and that's it. And so the disease model is this place of the body and the brain. It has a disease, right? The brain has a disease. There's genetics that are related to it. There's the brain structure is different, how the brain functions is different. All of these things that seem to support a disease model, similar to, heart disease is, you can have heart disease that's genetic, right? You get that from just genetic risks and genetic factors from family members and ancestors. And so the disease model comes with this assumption that you will always have this disease. There is no making it better. It is always there. It's always dormantly active. It's always kind of simmering under the surface, just waiting for an opportunity for addiction to take back over this person's life, right? So NA and AA are very much this disease model. They're very much this accept that you have a disease so that you can manage it for the rest of your life, go day to day, try to get by day to day, cope day to day, and that's how you stay in recovery. So the integrative model, the biopsychosocial spiritual model, understands, and this is the new perspective, a newer it's not really new because it's been around for probably what, 30, maybe 40 years now. Actually more than that, 50 years, because harm reduction originated in Europe. And so it's been in like 1980s. So it's been around even longer than that. So anyway, the biopsychosocial spiritual model is this perspective where addiction is a way to cope. It is a combination of a lot of complex factors and complex experiences, right? So trauma is part of the story, genetic risk is part of the story, coping patterns is part of the story, environment is part of the story, you know, nutrition is part of the story, spiritual health and spiritual wellness is part of the story. All of these things that are part of human experience, right? When you think about a person, when you think about yourself and you think about what makes me me and what makes me, you know, what has led to my patterns and my behaviors and my thoughts and my beliefs and all of these things, it's everything, right? It's everything about, it's this holistic approach, right? This holistic view of who we are as humans, who we are as individuals, how we develop, how we become who we are, how we become this particular way, how we develop beliefs and attitudes and patterns and habits. And so this model very much comes from this place of there are many reasons why addiction develops. There are many ways that addiction developed in the first place and is continued. So once someone starts to use substances frequently, then there's a lot of changes that can happen as a result of the use that makes it even more complex. So there's the way out of that, right? The way into recovery is also complex. It's a complex problem that requires complex solutions. And the abstinence only view just does not meet the requirements of a complex problem. It is a one size fits all. Abstinence is the only way, no matter what developed it, no matter where it came from, no matter how complex it is, it's very simple, right? The abstinence only model comes from this place of it's really simple, just stop using, which is so far from reality and so far from the truth about how complex addiction really is and substance use really is, that it only really works for a very short amount of people or a very small amount of people. In fact, most of the treatment programs in the United States are abstinence only based programs. And there are about 66% of folks that they're not successful in them. And there's even more that are not successful in recovery after a year, after 2 years, right? And so clearly our treatment programs and our treatment system and the system itself and society's system, right? Society's beliefs, social interventions on how to manage substance use and the social origins, it's not working, right? So we have to make a change, we have to make a shift, and that shift is harm reduction, because there are some people that will be able to quit overnight and never touch a substance again, and there's a whole lot of those folks that when they do quit substances, they start doing other things. They start having sex addictions, food addictions, they have other substances, energy drinks. That's one of the biggest, I feel like in my experience, my professional experience, that's one of the biggest replacers for substances is super toxic energy drinks. And so, you know, the harm reduction perspective helps folks come out of the habits of addictions without them getting transferred completely to something else. It helps them heal the reasons why addiction developed in the first place. It helps them heal the reasons why addiction has continued for them while they're getting better, while they are reducing their use and slowly making that progress towards abstinence. Maybe they never find abstinence, but they find reasonable use, right? AA and NA and the disease model, there isn't room for belief that folks that have struggled with substance abuse can ever get back to reasonable use and responsible use. There isn't room for that. And that's a false belief. There are many folks that they abuse a substance for a particular reason. Maybe there was a trigger, a loss, a divorce, whatever it may be in their life that created this substance abuse for a period of time in their life. And throughout time, throughout healing, throughout interventions, maybe treatment, maybe just going through problems and deciding I'm done with that they come back to a place where they can drink a beer or two and they don't have any problems with it anymore. They don't have the addiction symptoms. They don't have the problems with it anymore. That happens to a lot of people. In fact, there's a whole percentage, I think it's about 20%, I could be wrong on that, but there's a whole percentage of people that never get treatment. They never get help with addictions. They never have any interventions, official or professional interventions, and they just spontaneously get out of addiction. And it just, whatever reason, right? It's about the 40s, about mid 40s is when a lot of that tends to happen, where it's just spontaneous recovery. But it can happen to any age and it can happen to anyone. And so according to the disease model, that wouldn't be possible, right? But it happens, and it happens a lot. So there has to be an alternative that makes more sense and that is more supportive. So harm reduction, when harm reduction is a technique used in therapy, oftentimes family members are very, very negative about it. And the reason is because family members are frustrated. They're angry about different situations that have happened, about, maybe a theft or other situations where there was harm, hurt feelings, where there was problems that happen. And so family members, they want abstinence. They demand abstinence. If you are not sober and you are not abstinent, then you are still in your addiction. You're still a junkie, right? And so their family members are very, very abstinence focused. It's really challenging for family members to accept harm reduction as a treatment and as a way of recovery, an approach to recovery. And that's why I'm here, because family are so important. Family is so important to recovery. Family is so important to success in recovery. And if family members are expecting abstinence when it's damaging and harmful to expect abstinence, then we have to do something about that, right? There has to be some type of support that family can get to educate themselves, to understand why harm reduction is a preferred method for a lot of people, a preferred approach for a whole lot of people. And so for families, folks, if you're a family member and you're, watching this video, I really appreciate you taking the time to connect with me and to listen to this approach and this perspective, because harm reduction, if we were not to use harm reduction, which again, we've been doing this for many, many decades now, right? if we don't use harm reduction, then when people are using to deal with trauma, if you're expecting them to stop using completely overnight, they are stuck with trauma that sometimes can lead to suicidal thoughts. It can sometimes lead to depression, anxiety. It can lead to a whole lot of distress for your loved one. And this isn't distress that is they're uncomfortable for a minute and they're fine, right? This isn't that. This is, it's dysfunctional. It is traumatic, right? Like being expected to quit using a substance when it's the only thing that is getting you through the day and helping you cope with trauma, helping you cope with mental health, helping you cope with life. That is traumatic, to be expected to do that. And the outcome of, if they can't, right? If they try to quit and they cope for a week and it's so miserable and they relapse or they slip back into those patterns and use again, then there's the shame that comes, right? Then family members are like, oh, you failed again and you messed up again. Are we really gonna go through this more? You know, there's a lot of this shaming that happens, and shame is one of the top 3 triggers for relapse. And so I know that some of you are thinking right now, oh, don't blame me for that person's relapse. Don't blame me for their relapse. It's not my fault. And no, it's not completely your fault, but there also are many factors. Again, I keep going back to, there are many factors to how addiction develops, how addiction maintains and sustains. And one of those is shame. Shaming. Folks with substance use already carry around a boatload of shame already. Even folks that are completely in denial, that's another abstinence only perspective. People that are saying, I don't have a problem, you know, there's nothing wrong with my substance use. I guarantee that if given a safe person to talk to, given a safe environment for them to explore their feelings, given support and love in accepting that it's okay to have some problems from substance use, it's okay to not be perfect, it's okay to be human, that there is shame under there. And so every moment that a family member brings up comments or says comments about, oh, we're going through this again, or you relapsed again, how could you, you know, any statements like that that are negative and unsupportive, it is triggering the shame feeling that, like I said, is one of the top 3 triggers. The top 3 triggers for relapses are shame and guilt, grief, and trauma. So folks that have trauma in childhood and complex trauma, or even experiences, traumatic experiences that they just went through, you know, domestic violence, or witnessing someone harmed, or any kind of triggers to trauma. You know, maybe someone went through a trauma and then they went through a toxic relationship. I mean, those are traumatic too. That's one of the biggest triggers for relapse, because when people get sober, they don't heal trauma. Trauma is not something that gets healed overnight with recovery. In fact, trauma feelings, right? The experience of having trauma and the trauma response gets worse in recovery until they can start healing that trauma. And so again, going back to the expectation of someone being abstinent without healing these things first means that they're going to go through undue stress and distress that is highly triggering, and they're expected to stay sober when that's just, sometimes it's unrealistic. Maybe some people can do that, maybe they can bear through it, but should they have to? Should someone be miserable, mentally distressed, so that someone else can be happy that they're abstinent, right? Is that even realistic, right? So another, value and benefit of harm reduction, not only to help folks make progress towards abstinence or towards less harm from their substance use. Some of the value of accepting and using the harm reduction approach is compassion. When someone struggles with addiction or mental health and trauma, shaming them is far from supportive. What is supportive is compassion, empathy, understanding, love, caring. And it can be really hard for family to go through that because they feel like they've been taken advantage of. A lot of family members feel like they have been manipulated, that they've been taken advantage of. When they were nice and they tried to help, then their person stole from them or did something that was harmful to them. And so it's can be hard to bring that compassion forward and to bring that understanding forward, but it's required. And as a family member of someone with addiction, it's required that you're compassionate. It's required that you're understanding. It's required that you're loving, unconditional love. And that's one of the things to bring up here, topics and concepts to bring up here, is that as the tough love generation of parenting, right? The tough love of suck it up and you're fine and stop crying and those kind of things. That's where some of this lack of compassion comes from. And so, some of the shaming as parents shame their kids a lot. And I don't think they realize it though. I think that parents are taught, because we've been part of the tough love generation, that it's okay to shame your child or shame others in order to elicit for them to make a change in their behavior, right? If I shame my child about their behavior, about their substance use, then they're going to stop doing it because consequences suck, and their shame is something to avoid, so they're going to change their behavior. But it doesn't work that way. Shaming someone adds on to the pain. Okay, so if it changes their behavior for a little bit, then okay, consequences work for a minute, but then they don't. And then there's even more pain and more problems added onto it. So shaming is this very, very toxic way of change. Punishment, consequences, consequences and punishment are different. Like natural consequences of using substances is that your body is not healthy. You have toxic, systems and toxic organs, toxic substance in your bodies affecting your organs. A natural consequence to using is withdrawal, right? And so, but punishment is, well, you're going to go through withdrawal, and in order to punish you, we're not going to help you through the withdrawal. We're not going to help you with medications. We're not going to help you. I'm not going to do anything for you with that. I'm going to expect that you go through withdrawals without any help because you need to be punished for being an addict, right? That is toxic. That is shaming. That is, it is not helpful for the person trying to find recovery to be told that and to be treated that way. And in all reality, is that a humane way to treat people, right? Like, is that a way to treat people that comes from love and care and understanding and compassion? Absolutely, it's not. And that's where harm reduction comes in, where harm reduction is giving people compassion, giving people understanding, giving people love, even if they're making mistakes. We're humans. We're all humans. We are all making mistakes along the way. Some of us are making mistakes by using substances that cause us a bunch of problems. And sometimes we relapse. Sometimes there are slips. Sometimes people do struggle with goals. Sometimes people are unable to make changes in their habits right away, right? And being compassionate, being understanding means that that's okay, and that you still deserve respect. I think that's one of the biggest parts of harm reduction, you know, compassion and this approach that being human and making mistakes, even with substances, does not mean that disrespect is deserving, right? A person does not deserve to be ignored, to be shamed, to be rejected, to be thrown out on the street, to starve to death or to freeze to death because they use substances, right? That's not, it's not humane. And that's the harm reduction really provides this path for folks that struggle with substance use and alcohol use. It provides a path that they can get better while also getting better support. So if that means that someone is provided food, even though they're drinking, even though they're using, but they have food, then that's harm reduction, because we are at least honoring that they need to eat, that they're human. And a person that is starving, and again, this is one of those examples of the difference between compassion and support and punishment. So one of the responses to, well, if they're using and they cared about whether they ate or not, then they wouldn't be using, right? Like, if they're hungry, then stop using and you'll have money to get food, right? Like that, but that's a punishment perspective, okay? That's a perspective of, well, you use and you're using money for this and you're hustling to get money for drugs. Why can't you hustle to get money for food? And so we shouldn't have to help you, kind of thing. That is a punishment perspective. A compassionate perspective is, you are unable, or it would be a whole lot more challenging for you to focus on recovery efforts if you're starving. If basic needs are not met, people cannot improve in other ways, right? So the basic needs, hierarchy of Maslow's hierarchy of needs, basic needs are food, shelter, nutrition, and then it goes up, right? And then it works up to other things that are love, self-actualization, like all of the different other levels. The base is that people have to have their basic needs met. So if someone does not have those basic needs met, it is a whole lot harder, a whole lot challenging, if not for some people, not possible for them at right now to be able to improve on any of the other things, including mental health. People struggle, people that have mental health and have substance use, they can't improve the things that are necessary for them to improve on if they are starving and they can't get past that they're starving that day, or that they're stressed out because they don't even have anywhere to live, right? So there's definitely some improvements that can be made to really support folks in recovery by meeting basic needs. For people to be able to focus on their recovery, they need to be able to feel safe. They need to be able to feel like they're going to get a meal tomorrow. They need to be able to feel like they're not going to die, right? That they're the next few days they might die from starvation. That's not going to help someone in recovery. That's not going to help someone find recovery or even be motivated for recovery. You know, like if somebody is struggling with mental health and depression and suicidal thoughts, and their life, their shelter, their basic needs are not met, how could they be motivated to make change with their substance use if it looks helpless, if their life feels helpless to them and they feel like there's no help out there, that there's no hope, that there's no possibilities of things getting better. Why wouldn't they want to get high and drunk to deal with that, right? That is not, it's not something that that can be expected for someone to feel hopeless, helpless, not have any help, not be given any help and support, and yet still be able to make it out of severe addiction. Again, people do it. People do it all the time. But is it something that truly is humanely an expectation, right? Abstinence only and the perspective of abstinence only very much comes from this unrealistic expectation that everyone can do what some few people can do. Harm reduction is open. Harm reduction just says, there are many ways to recovery. There are many ways that people find recovery, and there are many complicating factors to substance use and substance abuse that lead to addiction continuing. And so harm reduction perspective says that for us to help someone find their recovery, we have to think about how complex the problem is so that we can be creative, we can be open-minded to what kind of solutions are necessary and what kind of things are necessary to help them with their recovery. So some harm reduction, some very, very common harm reduction techniques that people are probably most familiar with are needle exchange programs, Narcan, for example, and see what else. Fentanyl test strips are harm reduction. Some other, I don't think there's any places in the US that are like this, but there in Europe, there are places where folks can actually bring their drugs to a place where nurses are present to help them test their drugs, make sure they're safe when they're using. It's very controversial, of course, because harm reduction is so rejected, and so it's an alternative view that a lot of people have not been accepting of. But there's also other harm reduction techniques. So for example, a family member saying good job on being 1 day sober today is harm reduction, because maybe that person hasn't had a job yet. Maybe that person hasn't started helping with chores around the house yet. Maybe that person hasn't moved out and gotten their own apartment yet. Maybe, you know, they're still struggling with anger. Maybe they're still, you know, mentally up and down and irritable. But if they were sober for that day, that's something to celebrate. That's something to praise. That's a harm reduction technique. Another harm reduction technique is, hey, you normally drink an entire bottle of liquor, and yet this time you drank 12 beers. That is harm reduction. Recognizing the value of that progress, right? Because 12 beers compared to an entire bottle of liquor is a whole lot less problematic. It is a whole lot less intoxication. It's a whole lot less damage to the body. It's a whole lot less risk of making a choice that would put themselves or others at risk, like drinking and driving or violence. And so for a family member to recognize your typical pattern is to drink a whole bottle of liquor, and today you drink a 12-pack of beer, that's great. I'm really proud of you for that progress. That is harm reduction. I know that that feels like it's really challenging to do that. I know that there are probably many family members right now that are thinking there is no way I could do that or I could feel that way. But that's what helps people. That the harm reduction perspective where it's okay to make progress without perfection, that is where healing really happens. And so as a clinician and as a person that's sitting here teaching you about harm reduction and hoping that something here has connected and makes sense about harm reduction for you, my hope is that you truly understand that harm reduction is the way people get sober. It is the way people get better, because they feel good about the changes that they make. They feel good about the small changes they make. Because just think about quitting tobacco or reducing, reducing your sugar intake, not eating as much sweets. Not very many people can just all of a sudden stop doing that overnight, like abstinence, right? Expectation for substance use. There's not many people that can do that. And it's really distressing to do it, right? It's a constant thought on your mind. It's stressful, it's frustrating. And so, if you make little changes at a time, if you're trying to change your diet and you make a little change here, you make a little change there, you make a little bit more change there, that's how you make change. That's how you make sustaining change. Because here's another way that abstinence only perspective can be harmful. If someone stops using completely and they go through the cravings, they go through the triggers, the urges, they're struggling, it's really hard, and then they relapse, their relapse likely is going to turn into even more use. It's going to become more severe because it's a rebound effect. If someone is trying to stay sober and it's really hard, it's really a struggle, it's very distressing, it's miserable, it's like white knuckle trying to get through a day, if they relapse, that it's going to trigger this rebound effect of making up and trying to, I guess probably a good way to say it is trying to self-medicate the distress that they just went through trying to be sober, right? And so their addiction actually increases when relapses happen. So harm reduction, when someone is walked through slow steps, small steps into healthier use, less risky use, harm reduction use, right? When someone is stepped through smaller steps of improvement, the change lasts longer. The change is more sustainable. The change it does not have that rebound effect like abstinence only change does. And so that's another way where harm reduction is very beneficial for folks that are especially folks that have already tried abstinence. They've already tried to quit and they've already experienced rebounds. They've already experienced that, they're unable to stay sober longer than a week, or they're unable, to stay sober longer than a month. And when they use again, then it's a rebound effect. Another harm reduction strategy is for folks to use something different. If someone's using meth and they can get by not using meth if they use marijuana, why not do that, right? A lot of treatment programs reject that and say, if you're not sober on marijuana, then you're not sober, and you're not welcome into certain treatment programs if you don't have plans to quit using marijuana. And that's unfortunate, because for someone to ask for help for meth and be rejected, treatment is rejected because they want to keep using marijuana because that helps them get through the day and help them cope until they learn coping skills. That is sad. That is heartbreaking that people are denied help because they're not willing to quit everything, right? This abstinence only perspective. Yeah. So I hope that there has been something that has been useful today. and that there was something that was beneficial for you to learn about harm reduction and learn about the value of harm reduction. And I plan to continue to do some more trainings and some more education on harm reduction and harm reduction techniques and healing. You know, another aspect, just the final note on harm reduction is harm reduction is this understanding that if somebody's using substances to cope, right? They're using it to cope with trauma, they're using it to cope with mental health, they're using it for a purpose. There's always a reason somebody's using. It is not just the body just says I need drugs, right? Like this disease model of I'm just dysfunctional. My brain is just diseased. That's not it. There's always reasons why people use. And if those reasons that someone is using can be resolved during their time of using less, for example, trauma. If someone is receiving trauma treatment, mental health treatment, mental health services, and they are reducing the trauma response while also reducing their substance use at the same time, they're healing while they're reducing their use. That helps them to not, how do I put it? If they're healing at the same time that they're reducing their use, then they're healing addictions along the way. Because if you're healing the reason that addiction is there, if you're healing the reason why somebody uses a substance, then the substance use is automatically going to reduce because they no longer have as much reason to use, right? So a lot of times people, and even counselors, some counselors and therapy programs and treatment programs, the belief is that people can't heal or people can't make progress with mental health or other things if they're still using. If someone is using substances, then there is no ability, like the brain is not capable of healing. And I think I'm calling BS on that, because while it may not heal completely, while, you know, someone that struggles with anxiety is not going to completely be able to cure or get rid of their anxiety completely if they're still relying on a substance, there is things that can be helped. There are things that can improve while sometimes using substances to help as well. You know, and this is a common, which I don't understand. This is why I don't understand how there's some belief sometimes, because when someone uses a medication for anxiety, for example, like they get some Valiums or some kind of medication to help them with anxiety, and they do counseling, they are healing the anxiety with therapy while also taking a medication to help them function, to help them get through the day, to help them get through difficult times while also healing the anxiety. We don't judge people for that. We praise people. Good job on taking medications and going to therapy so that you can combine approaches and get the best outcome for your healing and your wellness, right? But when it comes to addiction, all of those, I want to say common sense ideas, right? Like all of those ideas of it's okay to get some medication for your struggle and do therapy so that one day you can get off the medication, right? It's okay for people with depression or anxiety or any other disorder or any other problem to be able to do that, except addiction. Except addiction. If you're using substances and you're using alcohol, then that's not okay. That makes no sense. I hope that my describing this is helping people see that there is this very, very different view of substance use and addiction from everything else. And it doesn't work that way. Using substances is going to have the same path to healing that struggling with depression would. And this happening, the things that are happening, the events that are happening where people that are using meth and they want treatment for meth, but they're still using marijuana and they're denied treatment. Why would someone be expected to cure their addiction or be done with their addiction before they're accepted into a treatment program? That would be like saying you can't get therapy for depression until you're no longer depressed. You have to stop being depressed before you can get therapy for being depressed. Doesn't make any sense, right? But yet that's what's happening. That's what happens with treatment all the time, is that especially outpatient, that's it. Outpatient treatments are saying you cannot engage in outpatient treatment unless you are sober. Abstinence only treatments. And that makes no sense. Makes no sense, because we would not expect somebody to no longer be depressed in order to get help with being depressed, right? So let's not do that with addiction. Let's not have expectations that are unrealistic for folks that are using substances. And that's all I have to say about that. It was a whole bunch to say, right? It was a whole bunch to say about it. And I'm sure that you can tell I'm super passionate about it. And here's the thing, people are people. People that use substances are people, and they deserve love. They deserve respect. They deserve the support that they need. And every single one of them that I have talked to in my work and that I've worked with and known in my life, they are all in pain. They are all in pain. They are wanting someone to still love them and still give them credit and praise for when those moments when they have failed and they relapsed and they slipped. The most healing thing can be if their loved one says, it's okay, I love you and I'm here for you. That's literally all you have to say for someone that has slipped or relapsed, for them to feel like it's okay and I don't have to do it again. I don't have to relapse again. I don't have to go use again. Because every time someone has a slip or relapse and a reaction that they get from the people that they love is, you messed up again, here we go again, that causes them to want to go and use again. Every time. Because that doesn't feel good. That the person that you want to just be there for you, that you want to support you, is just kicking you while you're down. So love your loved one. Love your person that is using and abusing substances. Even if they do you wrong, even if there is something that happens, you learn from it, right? You establish boundaries. You put down boundaries of, I'm no longer going to allow you in my house at 2 a.m. or whatever the case may be. You put healthy boundaries down, but you still love them. And you don't shame them. You give them the support and praise and celebrate. If it's been 5 days and they are sober, you celebrate that with birthday cake. That's what I like to say. Like, it doesn't matter how little progress there has been, you celebrate it like it's huge. Because here's the thing, every little step that helps people be a little more healthier, a little less risk, a little less damage, a little less harm to themselves or anyone else, that is progress, and that deserves every positive statement and every happiness feeling that you can muster into your heart. It deserves it all. So, okay. We will see you later. Have a great one. I'll see you next week. I don't know what the training is going to be next week. It will come to me this week. Along the way, I'll just think of, okay, this is what I want to bring to my people and my folks that are listening. So we'll see you next week.